Hi everybody, welcome to Beauty Buzz with Lori. So today I'm going to be demonstrating a teenage HydraFacial. This patient actually does not have like a lot of acne or anything like that, so we're just going to be clarifying her pores today and just bringing a pretty glow to her skin. So I'm going to go ahead and get started. I'm going to start by cleansing and exfoliating, and then we'll get started with the HydraFacial machine. Normally, if a patient had acne we were dealing with, I would use the Dual Action Scrub by Zeo Skin Health. But with this patient, I'm going to be able to just give her a nice polish with the exfoliating polish by Zeo Skin Health. This just feels really nice on the skin. It has magnesium crystals in it, which is what does the actual polish. They are tiny, tiny little round spheres, so there's no risk of any lacerations on the face. Started with the actual HydraFacial process. So I always like to do a manual cleanse and exfoliation prior to starting with the HydraFacial, just in case the patient has makeup on or any oils or things on their skin. It doesn't get kind of gummed up in my handpiece with my machine, and then the machine also does a second cleanse. The nice thing about this facial for this patient is because she doesn't have any acne on her skin, it's just going to brighten her skin, make it more luminous and refreshed looking. Step is going to be the chemical peel. So this is a young patient, and so I don't typically do higher strengths, especially not for their very first facial. So this is for very first facial. We're going to stick with the Peel Prep, which is 7.5% glycolic, 2% salicylic. So what's nice about that one too is that if she did have a lot of acne, the salicylic is oil soluble, so that assists in getting down into the pores once it's deposited on the skin, and it helps to break up that oil, that sebum that's in the pore, along with the dead skin cells, so that when we do the portion of the facial where we do extractions, it's going to just kind of slide out just like butter. So it makes it very nice both for the patient and for myself. Okay, so this peel can be, especially for a first timer, a little tingly. Shouldn't be burning at all. Just a little tingly for about 60 seconds. I do always keep a handheld fan for my patients just in case they feel like they need it to make it more comfortable. So this is the point in the procedure where I change out the tips. I have a smaller tip that is designed to be able to get in those alar folds on the nose because that's where we all can carry a lot of congestion. So I can get in larger areas as well as smaller areas. So typically with this facial, we're just dealing when we're doing extractions with the forehead, the nose, basically the T-zone area. If a patient does have them on their cheeks, obviously we address those as well, but as a rule of thumb, typically staying within that area, because we are at a higher suction on this so that it can actually pull it out. Okay. Again, she doesn't really have anything on the forehead. So I'm just going to go over those areas in case there is anything in the pores that I'm not seeing that we want to get out. The nice thing about this facial is that whenever we're done, whatever we did pull out, we can actually see in the canister behind the machine. It's always fun for the patient to take a look at. I like to leave the nose for last because that is usually the one area where teenagers, most anybody honestly, have the most blackheads, and so I like to let that solution from the peel kind of stay on there the longest. So I usually hop from the forehead down to the chin. The chin can be just as congested as the nose. On this patient, that's not the actual case, so again, why I'm skipping down to here instead of doing the nose next. So even though she doesn't have a lot of acne, I don't know if you can pick up on camera those little particles in there in the head of the handpiece. Are actually sebum that has come out of the skin. It's making its way through to the canister, so that's kind of cool to see too. And I see a couple of little blackheads that are stuck tight that I'll have to take the lancet to, and then they'll come out and slide out nice and easy. At least that's the plan. They don't always cooperate, but we'll see how these react. Alright, so this is the way I like to do it. I use a couple of Q-tips. I have nails, and so that can be painful for the patient, and I want to not inflict pain as much as possible. So I use the Q-tips whenever I need to do a little bit of squeezing. Sometimes I do have to, on a larger area, use the sides of my finger in order to accomplish that as well. And then a little area over here, I'm just going to do this. You may feel like just a tiny little pinch. These are like a little ball sitting on top of the skin. Sometimes they kind of move around, so I'm just trying to get it to where it's easy to pull out. Sometimes they lift right out on the lancet, and then other times you just have to squeeze them out. You doing okay, Emma? You can see it's right there. It's trying to come out. Sometimes they need a little manipulation because they have been in there for a while and they're sticking to the follicle, the walls of the follicle. As you can see, it's all gone. That was pretty easy. Was that painful? Mm-hmm. Better. All right. And then I guess that she's got a little. Try to get this one for me. There's a pretty decent sized blackhead right there, and it's, you know, like I said, this is her first facial, so it's going to also be stuck to the follicle wall. So I just kind of stick this in and kind of outline the walls. And let me know if this is uncomfortable for you. Just helps to loosen it up, so when I go to get it with the extractor, it's going to hopefully lift right out. Okay. And I have shown you guys the extractors before. If you're using this, just be super careful because you can break the skin. It's metal, so you can see that came right out. Okay. And we're going to do this one over here. sometimes you have to try a few different things in order to get it to come out. If it doesn't come out the first time, doesn't mean it's not going to come out at all. Just suck it right out of there, and I'm going to go over these areas as well. On my teenagers, I do like to kind of squeeze the alar folds a little bit on the nose, and the reason I do that is because, especially this is her first time, there's for sure some down in there that I haven't been able to get to and that it's not been able to suck out of there. So, and I'm going to have you turn your head slightly to the left, and then I'm going to close off the right air passage and breathe through your mouth also if you need to. So we're just going to give a little bit of a squeeze and see if you can see some little white stuff coming out right there. So that's what I'm talking about. We got some of it out, but not all of it, and we want to make sure that the patient's clear. And again, this is not comfortable for the patient either, so you want to try and do it as quickly as possible, but still giving them a nice result. And we're going to do the same thing on the other side. So again, I'm going to close off your left side of the airway. You can breathe through your nose if you need to. Seal off that nicely. And I can see some pores on top of here, but everything looks super clean, so I'm not going to give that a squeeze. And she's all good. Now I'm going to dispose of this particular one because it has the peel residue on it. And I'm going to put the other one on, and this one helps with the hydrating and nourishment of the skin, so that last serum that we're going to be putting on the skin. I am going to do the last serum, and then I'm also going to do the blue light on here because we did extractions. The blue light will actually help to kill that bacteria if there was any sebum left in there. That way she doesn't have a breakout after her facial. Okay, so we're going to neutralize the peel. It's neutralized just with water, so I like to just use my hands first and then go back over with the sponges. Emma, are you feeling any tingling or stinging sensation on the face anywhere? Okay, perfect. So once the patient has told you they don't feel anything on there, that means that the peel is completely neutralized. If she had said yes on like my upper lip or my forehead or something like that, then I would go back over that again with water to make sure I fully neutralize the peel. Some patients who have the acne really bad and everything, the peel prep is also safe to leave on the skin. With your patient, just to alert your patient that it may make them peel and also may make them feel a little more dry than they normally do. So, but that is temporary and will pass. Okay. And this is just literally depositing the serum nice and tight on the skin. So the idea with the serum is to, if you get this whole side of the face done and then start this and it starts being completely dry over here, their skin is kind of sucking up that serum, and that means it's probably dehydrated and needs more serum. So we want to do this basically until the patient the skin is not any longer sucking up that serum and going dry really quick. The last serum has hyaluronic acid, peptides, and antioxidants in it. So that's what I mean when I say we're hydrating and nourishing, because that hyaluronic is helping to hydrate and plump the epidermis and the dermis. And then the peptides are your anti-aging and also firming. And then of course your antioxidants are always good for nourishment on the skin. So instead of rubbing that into her skin, what I'm going to do is place some protective eyewear on her eyes, and we're going to do the blue light. And with the blue light, I just want to hover over the areas that I've extracted. So I like to leave it on for about 30 seconds and then move it to another area. And this is just the blue LED light that's calibrated to, like I said, kill bacteria, both on the surface of the skin and underneath. We also have another modality called high frequency that we use with acne patients. That also kills bacteria both on the surface and underneath the skin, and it's not an LED light, it's actually an infrared light that helps with that. And so if that's needed, I also do that. I actually utilize that a lot on skin of color because everything that's on skin of color does not necessarily need to be extracted. There's things that you don't need to extract and things you should extract. You have to be very careful because you can scar them with that post-inflammatory hyperpigmentation by pressing too hard on the skin or making a mess of it with a lancet or something like that. You just have to be really, really ginger with them so that you don't mark up their skin. Okay, and again for the blue light, it's only necessary to really do that over the areas that you've extracted. Okay, and that serum has already melted into her skin nicely. So with all my patients, I end them with an eye cream. Even my little young people, I do that with. They don't have, it's a maintenance thing. Good skincare is never too early to learn. As a matter of fact, it will help in the long run with when if you may need a facelift or any type of surgeries. This is Neocutis Bio-Cream Firm. It works for all skin types. However, if you do have super oily skin, we put you on the Bio Gel Firm. It works a little bit nicer with oily skin and super oily skin. Okay, and then I'm going to also end her with a sunblock. She has fairly even skin, so she could technically get away with a chemical sunscreen, which will, it's a little more elegant on her skin and won't leave that white cast on the skin. Zio has come out with a powder that's kind of like a makeup, and it's a mineral 40 SPF, which is really nice, and it has proven to be really nice for the darker skin tones as well. I am going to go ahead and use the liquid chemical though. It also has zinc in it, but it does have the chemical as well. And so we're just going to use this. It's called Chimay. It goes on nicely for colored skin as well, without leaving that white cast. And it has also got anti-aging properties. I know it seems weird to be talking about anti-aging on a teenager, but again, it's never too early to start. You wouldn't want to use like potent ingredients because that could actually have an adverse effect on the skin. But age-appropriate skincare, of course. Okay, so once I've applied eye cream, moisturizer, and sunblock, I'm going to finish the facial with a little bit of a lip treatment. The lip treatment is just this PCA Hyaluronic Lip Booster. This is one of my absolute favorites. It's a twice a day. You can put it on in the morning after you've cleansed your skin, and then you can also put it on before you go to bed. And I tell you, when you put it on before you go to bed, you wake up with the most hydrated lips. It's so nice. And so I just apply it with a Q-tip for the patient and then have them rub their lips together when it's done. And I feel like this is just a complete look. Okay, rub your lips together for me. Perfect. Really nice. See that big one?
Mm-hmm.
Yeah. And then the little white flakes you see in there, that's all dead skin cells. But look at your skin in the mirror. Okay.